Okay, guys, this is Dr. Bhupesh from Dr. BKM Institutes once again. Today we are going to do listening, but in listening or any other module, I would say any other module, again, the rules remain the same, especially when I talk about this rule. This is what I always teach, and this is one of the best thing that I can teach you as well. B. B is equal to B is again, as we all know, is MR. Was were is the second form of be, and third form is been. These are the three forms of be. This is what I told you when we did reading as well. I told you should know active passive. Active passive has only one rule, be plus third form. This is very important as we discussed in the last reading video as well. This tells us whether the question is active or passive. We had one example as well where we talked about uh, women were denied treatment, HRT thing. We discussed about women were denied treatment. So that was basically the question, why were the women denied treatment? Were plus third form means it's a passive voice. What does a passive voice means? Why were women denied treatment by someone? So that means someone else, like doctor or someone denied the treatment. So that is what we discussed. So you should recognize passive voice, be plus third form. This is the first rule of listening, reading, and even in writing when we do visits things. 3 days ago, patient was diagnosed with, so was plus third form, patient was diagnosed by the doctor. So this is the first rule we discussed. Second important thing, we talked about adverbs. This is again the same rule of reading, and that is where elimination methods become possible. Ly words should be eliminated, forever words should be eliminated, always words should be eliminated. These are the words to be eliminated. None, every day, these are the strict words. So these words are supposed to be eliminated. These are known as majorly adverbs. Adverbs are of different kinds, like related to time, related to position, like prior word we discussed, after word we discussed, that you have to read these words very carefully. Prepositions are very important in listening. To, from, for, these are prepositions. These help you to reach to the right answer. So before I even start doing listening, these things I should know. Again, I'm writing it again. Active, passive, first thing. Second thing, adverbs. Adverbs means word like ly, every, after, before, and prepositions of, etc. And the last and the third rule was of degrees, which we also discussed. But somehow, when we talk about these things, sometimes you don't understand them in the first place. So that is why I'm telling you again. Degrees means good, better, best. So these are the degrees: late, later, latest. These are the degrees. So you have to understand, whenever there is the best in the question, answer will also have the latest, the greatest. And when there is second degree, this one in the center, better than, later than, the recognition is the word then. So then is the word of recognition in these. So if question has this word or option has this word, there are high chances they can be eliminated or they will help us to find the answer. Please listen to that video again of reading just prior to this video, because this will help you to remember the rules. But today I just wanted to tell you the rules again before we make a start to the listening. So now I will choose the listening according to your choice. So I am going to unmute you, because if I do listening of my type, it will not make any sense. So what I will do for you, I will tell you to choose the listening, and you tell me any listening you want to do, and also I will let you know whether that listening is good enough or not. Some listenings are not really up to the mark because the material created is not always up to the mark. So I also will tell you that these kind of listenings are not supposed to be done. So if you remember any listening part A that you want me to discuss, it would be a good idea. And also the best part I would like to tell you, even in the exam, you will get listening part A. So the first strategy and the first major tip of clearing your OET exam, OET listening is that when you go to exam, when you before the exam, again prior word, again listen to it very carefully. Prior to the exam, please listen to something in English. When you get up in the morning, take God's name, do your rituals, and then listen to something in English before going to exam. Because like now I am teaching you, I have not done any warm up. Warm up is very important. So that is the major mistakes candidate do, and that can be one of the major reasons of not passing in listening, that people do not warm up. Suppose a cricketer or a footballer goes to directly to the field and says I'm going to rocket. It does not happen. Great players become great when they follow strategies, when they do warm up. In the same way, to all of us, warm up is the first thing that I would request you, that will surely increase your 20 points. आप सोचो ना, think about it. You went to the listening exam straight away, and the first five questions were difficult. Whole of the exam will go in panic. Whereas when you get up in the morning, you listen to something in English. You don't judge yourself, don't do the answer, but listen to something in English. Do one or two questions. It will give you a very good warm up. So if by chance you have come here to crack the listening, and we will follow the major things in between as well. But if it's all about passing listening, this will improve your 20 points. Get up in the morning, calm and relax, do your rituals, have a shower and everything, and listen to something before you go to exam. This will set up the tone of your day. And don't judge yourself. Don't try answers. Means try to do answer, but don't check it whether it is right or wrong. It's not going to make any difference now. So this is the first major listening tip. And if you have come here to pass the listening, this tip would be sufficient enough to improve your 20 points. So our lecture is already successful if you follow this tip. If you don't follow this, then it is a failure. If you follow this tip, this is something that's going to pass you, because listen to something in English, it will be a warm up thing for you. When warm up is good, things are going to be absolutely fine. Okay, now coming to the basics. If the basic or the fundamental or elementary, I told you the word in the reading as well, it's going to come to you. So now tell me any listening that you want to do, and I will type it here, and we'll try and execute that listening. I'm just going to write YouTube. Okay. So again, I don't want to be specific that this is the listening I want to teach, because if I would not be honest, how would I teach? I will try my level best कि आप जो listening कहोगे, whatever listening you will say, I will try and execute that. So you tell me which listening would you like to do, and then we will do something. Okay. Which listening? Tell me what should I type?
Ma'am, sir, which listening those are come in exam?
Sorry, the listening that is coming in the exam. I,
Yes, ma'am.
I wish
Sir,
I
sorry.
knew, and I would have been the richest man of the world. This is
Sir, the
little.
possible,
Okay,
the
I will
possible
write
chance maybe.
OET listening sample for nurses. Let's make it simple. Okay. Any listening that you would like to tell? Okay, 2025. So I have not been in much of forms. So if you want any of this listening that I should try, any listening, should I try this listening? In this part of the test, you'll hear a healthcare because professional, because Sarah I Chen, want to teach you the basics of listening. So first thing that we have covered is that you need to first of all understand. Just a second, yeah. First of all, you need to understand that early in the morning warm up. Second thing now we are executing is this one. Okay, I'm just, yeah, I just want to take this thing a little smaller. I want to make this thing a little smaller. Yeah, okay, I will put it here. And okay. In this part of the test, you will hear a healthcare. Okay, 1 to 24 questions you all know. It's going to be simple fill in the blanks. But I will tell you the strategy after listening to this, because even I am doing listening after a long time, because I normally don't practice. So I have not done a good warm up. So they are saying you will hear a healthcare professional, Sarah Chen, physiotherapist, consulting with the patient, Mr. Collins, regarding his progress following a total knee replacement. So first of all, you need to understand the situation, that there is something that this listening is all about. where this Mr. Collins regarding his progress about the total need. You will need to use the information, complete the numbered gaps. Okay. First of all, again, try to understand the topic, because once you understand the topic, you try to guess total knee replacement. Questions would be regarding the knee pain. Then after the placement, there would be medications that would be involved. So first of all, warm up gives you a little bit of idea. In this way, this is also part of warm up only, that I try to guess what kind of questions will come. So I'm going to take a little further, and then they will give you some seconds. Let's see how many seconds would they give you in the exam to practice it. Okay, let me see this one. Okay, just give me 1 second. Just as good. Mention.
Please go ahead. Good morning. Please come.
Okay, let's see how many seconds. I think they will give you around 60 to 90 seconds to prepare, or maybe they are writing only 30. Okay, let's see.
All right.
Okay, so they have given 30 seconds. So first of all, in these 30 seconds, again, try to notice everything, whatever I have told you. Again, I will show you what you need to notice. Yeah. After. I just want to take this pencil, but it's not coming my way. Are you guys able to see this? Is it visible to everyone?
Yes, sir.
Okay, I'm just taking this pencil. Yeah, finally I have got where it is. Thank you. Okay, so now I'm taking it. I will. So first of all, in 30
Please
seconds.
come. Have a seat. How are you doing today?
Good morning. Thanks. I'm doing all right.
Okay, Manpreet ma'am, can you please mute it? Okay. So the first thing is that I will try to notice these important words like after, and I will try to read the topic in 30 seconds. Reports feeling stronger. Stronger is my this word, and note completely dash after the activity. So reports feeling stronger and note completely dash after activity. Then they were talking about symptoms and feelings. Primary issue on walking is dash in the knee. Again, my preposition, that is what I have already told you. When people would listen to this lecture, again, I have already mentioned these are the things you note. Requires dash of gentle movement off word, mostly in the dash of the increased activity. Note swelling, mostly in the dash or after the increase. Swelling in the knees, something like that should come. So we try to guess the word. Primary issue on walking is dash in the knee. Pain can be one of the words, so you have to pre-assume some words, so they help you in filling it in nice easy. Yesterday completed a is articles are very important in reading part A and listening part A. That's why they are given. Even if you see the next question, swelling resolves if. So how the swelling, if the leg is elevated, swelling usually revolves slowly or fastly, something like this should come. So I try to guess whatever can come. Average pain score over 2 weeks is a dash. Then if I talk about pain relief involves taking dash occasionally. Pain relief taking these analgesics. Analgesics can be a name as well. So let's say whether they take the medication name or something else. Significant milestone, able to walk indoors without the dash, without the support, able to walk indoors without the limp. Limp is the word you know. It is used for the word for the sticks. So something like this can come. Patient is compliant with the home exercise, performing it dash a day, performing it twice a day, thrice a day, increased walking duration by no more than dash each week. Advised to hold stretches, heel slides 4. There is a preposition for 30 seconds. So timing will come. So this is the only time you will get in the exam. In this time, you just try to guess whatever answers could be. And you overall understand the topic. The topic is about last review 2 weeks ago when he had knee replacement. Completely reports feeling stronger and not completely dash after activity. These are the things they have told. And then they have talked about symptoms and findings, clinical assessment, management plan, and stiffness. Now let's listen to it and let's try and execute this listening. Okay.
All things considered. A bit better than last time, I think.
By the time I am doing you, I don't know whether in the final exam you will you normally follow this thing, but it is a very common thing. Never use the word like me. This is very important. Me, my, because patient will say I had pain in my knee. So never use the words like my, me, or even. So you have to use third person because you are writing these notes as a nurse. So you will write his or her. Please remember, if by chance you write, normally don't use it. But if you have to write, if she says in my knee, never use the word my because you are taking these notes as a nurse. Second important thing, medication name. If there is a name of medication like ibuprofen, there is a marks for the spellings. But if there is something like flamiclave, which is amoxiclave, amoxicillin plus Flamiclave, Amoxiclave, these are the brand names. In these, even if you do wrong spellings, they will not deduct your marks. Important rule of listenings. Third, if there is anything like Addison's disease, normally if by chance you write the wrong spelling or Alzheimer's disease, they will not deduct your marks because these spellings are on the name of a scientist. But if it is about hypertension or diabetes mellitus, then they will deduct your marks. Again, repeating the core rules of listening. Sometimes people don't know about it. Don't write my, mine, these kind of words. Brand names, spellings, by chance mistakes are allowed. Diseases like Crohn's disease. Otherwise, you know the spelling, but try to be correct, as much correct as you possible. But these spelling names, they do not deduct the marks for the scientist name spelling. Like if there is a name like Trendelenburg technique. So by chance BURG, you write BERG, still they will give you marks. But again, try to be as accurate as you can. I hope you have understood the rules until now, and let's play the listening. So these are the things I remember. Warm up in the morning. Second thing I will do is try to understand the topic because my subconscious mind starts finding the words like twice weekly, third time, without the limp, without the stick. So these are the words that help me to understand. And now I will play it. Okay, let's play it.
That's good to hear. It's been 2 weeks since our last session, hasn't it? How have things been?
Now, these are the keywords that I understand. It's been 2 weeks. So don't take anything lightly in your final exam because now she is talking about 2 weeks. This is where my mind gets alert. Now my mind is in alert form. My mind is in super alert form because now she has talked about 2 weeks. I just have to read the word stronger and note completely. Ly word is there, after word is there. So ly and after, these are the words which are important for me. Let's listen again.
Managing at home. Any major changes or concerns since we last met?
Yes, 2 weeks already. Time flies, even when you're taking it slow. Well, overall,
Now, one of the again most important things, when she is saying something, it is not important because answer is going to be from the patient's point of view. So whenever the male voice will come, that is my voice. This is the voice I will concentrate upon. Please understand these small things. This save lot of energy because whatever he would be saying that I have to notify, and whatever the lady is saying, it's not that important. And second, whenever I have to write in this, I will write his because he is a male. So I can't write her. Small things, but make lot of difference. Let's go further. Okay, small things. Yeah.
I'm feeling stronger, definitely. I can get around the house much easier without feeling completely drained. But I have a couple of things I wanted to mention.
Please go ahead. That's what we're here for.
Now he has used the word completely drained. I hope you all have listened to the word. So this is the word I have to note. But the thing is that he has not used the word after activity until now. That is what is my problem. So I'm not sure. If he reaches on primary issue, then I will write the word drained. But if he still talks something and does not mention about primary issue on walking his dash in the knee, if he keeps on talking, then I have to focus because after activity word has not been spoken yet. So I keep on concentrating. Okay. So yeah.
Right, so the first thing is the stiffness. Every morning when I first wake up, my knee feels incredibly stiff. It takes a good 15-20 minutes of gentle movement before it
Okay.
starts to lose.
So now He is talking about, so now I can listen. He has reached up to this level, gentle movement. So now I will fill the word drained. I will use the word stiffness in the knee. So that is how I feel. So I have to be really there and present. I hope these two answers would be correct. I'm not sure, but I will listen to it afterwards. Let's go further. So what does he require? Let's listen to that again. And always, without, rather than checking your answers, there is one way of gaining confidence. These all instructions what I'm giving you are very important because I myself do this. Now either I can check the answer or can do my listening again and can recheck my answer myself. This will make me stronger. Suppose I listen to it again. Okay.
Good morning. Thanks. I'm doing all right, all things considered. A bit better than last time, I think.
That's good to hear.
Generally saying, really sorry, I'm poking you in between. I understand you want to listen, but I'm here to teach you. Sorry for that. See, better, stronger. When you will start noticing these things, feeling better, again, better has to be replaced by second degree, stronger. So that is where you get to know what he's saying and whether we are noticing the right things or not. So, yeah, feeling better.
It's been 2 weeks since our last session, hasn't it? How have things been managing at home? Any major changes or concerns since we last met?
Yes, 2 weeks already. Time flies, even when you're taking it slow. Well, overall, I'm feeling stronger, definitely. I can get around the house much easier without feeling completely drained, but I have a couple of things
So, after activity word has been replaced by getting around the house.
I wanted to mention.
Please, go ahead. That's what we're here for.
Right, so the first thing is the stiffness.
Now the primary word has been replaced by stiffness. A primary word has been replaced by first.
Every morning when I first wake up, my knee feels incredibly stiff. It takes a good 15-20 minutes of gentle movement before it starts.
Okay, now please understand. This is also important. One more important rule. Primary issue on the walking is stiff in the knees. Stiff word will not fit him because he has talked both the words stiffness and stiff. So this is also your responsibility to fill the exact word, like you have to match the line. Primary issue on walking is stiffness in the knee. You can't write stiff. When he said my knee is stiff, so some people will write stiff. It is wrong because the sentence is like this: primary issue on walking, off walking आना चाहिए था, on walking is stiffness, requires 20 to 30 seconds of gentle movement or something like that he has spoken. We will listen to it. So over here he has mentioned the time. So okay, we will listen to it again.
Activity. And how does that swelling feel? Is it warm to the touch? Is it
Sorry.
painful when you... That's a very common experience at this stage of recovery. It's this last once you started moving. That's what we're here for.
Okay.
Right, so the first thing is the stiffness. Every morning when I first wake up, my knee feels incredibly stiff. It takes a good 15-20 minutes of gentle movement before it starts to loosen
15
up.
20 minutes.
It's not painful, not really, but it's quite restrictive.
Nodding, making a note. Morning stiffness, okay. And how long does that stiffness last once you've started moving? Does it come and go throughout the day, or is it mostly just in the mornings?
Mostly in the mornings. Once I'm up and about, it generally feels much better. Sometimes if I sit for a long time, like watching TV for an hour or so, it'll get a bit stiff again when I stand up, but not as bad as in the morning.
That's a very common experience at this stage of recovery. It's often related to the joint fluid settling overnight and the tissues themselves still healing and adapting. What's the other thing you wanted to mention?
The other thing is a bit of swelling. I notice it mostly in the evenings, especially if I've been a bit more active during the day.
Now, importance of articles. This is a very easy listening, I agree, but I chose it randomly. But again, whether it is tough or easy, in the evening, usage of article in the evening. So I have to fill the word with the. A and the. These are the articles, also known as the according to situations. So in the evening. Okay, let's go further.
For example, yesterday, I walked around the local park for about 20 minutes, much further than I've been doing, And by the time I sat down for dinner, my knee felt a bit puffy. It's not huge, but it's definitely there.
Writing another note, mild swelling after increased activity. And how does that swelling feel?
I've missed a word completely, completed a dash walk. So that is what I have missed, I guess. In the local park, completed a round of walk or something like that should come. But yeah, that's okay. I will listen to it again. Rather than checking out the answer, please improve your listening. That is what I say. I'm not saying stop at every point. No, we don't stop at every point, but I'm teaching you. That's why I'm talking about this thing. I will try to solve my 12 questions. If I have missed my question, if I want to improve my listening, I will do it myself rather than checking the answer.
Evenings, especially if I've been a bit more active during the day. For example, yesterday, I walked around the local park for about 20 minutes, much further than I've been doing, and by the time I sat down for dinner, my knee felt a bit puffy. It's not huge, but it's definitely there.
Writing another.
So I really cannot guess any word, but I think he said morning. So a morning walk can be one of the things, but yes, I can afford to lose 1 or 2 marks, but I won't create panic. Okay, so let's go further.
Note, mild swelling after increased activity. And how does that swelling feel?
Now, always by the time she is talking, I am always reading the next question that how would the swelling usually resolves. So I have to find the solution now. Okay.
Is it warm to the touch? Is it painful when you press on it?
It's not particularly warm, no, and it's not really painful to touch, just feels a bit tight and full. It usually goes down overnight if I elevate my leg.
Okay, thank you for sharing that.
Okay.
Both.
So now I can write resolves overnight. So this is how you keep on doing your answer. One question I have missed. Fifth, I'm not sure, but rest I'm pretty much sure. I hope drain would be right, stiffness would be right, 15 to 20 minutes should be right, evening should be right, overnight should be right. Morning walk, I'm not sure. So when you have these things, obviously all the questions cannot, but we are targeting minimum of 10 in 1 to 12, minimum of 10 in next 12 to 13 to 24. So 10 plus 10, 20 we want to score in this part so that we can score 10 marks from part B and C. We will try to score more because if listening part A is the major thing that gives you 24 questions. So you should score more than 20. So don't stop practice of a listening part A unless you score more than 20. Okay, I will take you further.
The morning stiffness and the mild swelling after activity are very typical things we see 6 weeks post total knee replacement. It sounds like you're paying close attention to your body, which is excellent. Now, let's go through some of my assessments.
Major words, whether reading or listening. Now, this is my way. Over 2 weeks. This is what alerts me that when my answer will come, average pain over 2 weeks is a dash. Let's see.
Questions, if that's all right.
Yes, absolutely.
Great. First, let's talk about pain. On a scale of 0 to 10, where 0 is no pain and 10 is the worst pain imaginable, what would you say your average pain level has been over the past 2 weeks? And what about your worst pain?
My average pain, I'd say it's usually a 2 or 3, just a dull ache sometimes. The worst pain, maybe a 4, and that's usually after I've pushed it a bit too much, like with that walk in the park. It's nowhere near the pain I had before the surgery. Thank goodness.
That's fantastic progress. A 2 to 3 average is really good at this stage of recovery. And
Otherwise, she has repeated it that 2 to 3 weeks, 2 to 3. But even if she would not have repeated it, my answer stays 2 to 3 because he said worst pain is 4. Again, we will listen to it again. These are the small mistakes we don't know. When we come back, we don't realize what mistakes we have done. But see, he also talked about 2 to 3. He also talked about 4. But 2 to 3, he said is normal average pain. The maximum or the worst pain was 4. My question is, what is the average pain? So that is where I need to focus. Let's see.
Walk in the park? It's nowhere near the pain I had before the surgery. Thank goodness.
that's fantastic progress. A 2 to 3 average is really good at this stage of recovery. And how often are you needing to take pain medication, if at all?
I've mostly stopped the stronger painkillers. I just take paracetamol occasionally, maybe once a
So this is easy, paracetamol. So you just write paracetamol.
day, or if I know I'm going to be a bit more active. Sometimes I don't take any.
Now, by the time again he is speaking, my focus is on the next question. In this frame of mind, I am doing my next question. Significant milestone, able to walk indoors without the.
At all.
Excellent. That shows your pain is well controlled and decreasing. Next, let's talk about your activity tolerance. You mentioned a 20-minute walk. How does that feel compared to, say, a week or two ago? What kind of activities are you able to do now that you couldn't before?
The 20-minute walk felt like a big accomplishment. A couple of weeks ago, 10 minutes felt like a marathon. I can now walk around the house without the crutch, which is a huge relief. I still use it if I'm going outside or if I feel a bit unsteady. I can manage stairs much better now, one step at a time, leading with my good leg going up and my operated leg going down, just like you showed me. I can also stand for longer periods while doing light chores like washing dishes.
That's wonderful progress. Being able to ditch the crutch indoors is a significant.
Okay. So this was a hard blank out of all the blanks. Without the crutch, that is what she has used. And she has used the word ditch. Ditch means is like without using it. Ditch is kind of a word used for deception, धोखा देना, deceive करना. So they use it in a different informal way. So I will try to redo this question because this was the
Milestone.
toughest.
It shows your
This
strength.
was the toughest question because he spoke so much. At one point of time, I thought he has even closed the management plan. Trust me, this is what confuses everyone in the exam. But you keep focus that you have to get the word compliant. The major word that I kept on focusing was home exercise program. He has not spoken until now. So till the time he will not talk about home exercise program, that means he is on this question only, no matter whatever he speaks. So the next question to be kept in mind is very important. I will tell you again, this was a very long conversation, and in the final exam, this is what gets your heart to race, and your pulses to
bit
pound.
unsteady.
Okay.
I can manage stairs much better now.
Let's
Okay.
talk about your
Okay.
activity tolerance. You mentioned a 20-minute walk. How does that feel compared to, say, a week or two ago? What kind of activities are you able to do now that you couldn't before?
The 20-minute walk
So
felt
even lady had a long statement, and now he will have a long statement.
like a big accomplishment. A couple of weeks ago, 10 minutes felt like a marathon. I can now walk around the house without the crutch, which is a huge relief.
So without the crutch, and the best part is that they help you that even the lady will say this word again.
I still use it if I'm going outside or if I feel a bit unsteady. I can manage stairs much better now, one step at a time, leading with my good leg going up and my operated leg going down, just like you showed me. I can also stand for longer periods while doing light chores like washing dishes.
That's wonderful progress. Being able to ditch the crutch indoors is a significant milestone.
Ditch the
It shows
crutch
your
indoors.
balance.
Ditch the crutch indoors. That is where she repeated.
Improving. How about your home exercise program? Have you been?
So this is what I was talking about. Till the time they will not speak the word home exercise program, I know no matter how much he speaks, I have to find the answer from these lines. So that is where the confusion happens, and that is where we lose 1 or 2 points, which are very critical. Sometimes people get, I'm really sorry to say, but sometimes people get 340. A question like this would have made us reach 350. That is what concentration is all about. That is what this exam is all about. If we scored 20 to 22 in the part A, we can't fail. We all know that because in the part B and C, total 4 plus 4 plus 4, 12 questions would be doable out of 18. 18 question in the part B, at least 10 questions would be very easy. So we have to just crack those 10 questions and 20 from here minimum. So that is how you keep the scoring in your mind. Scoring is very important. So let's go further. Home exercise, performing it dash a day. Let's see how many times a day.
Able to adhere to the exercises we discussed? How often are you doing them and for how long?
Often word is frequency word. How many times? This is also a very important word to be noted. Reading and listening always. This often is equal to frequently. Frequently means how many times or how often.
Yes, I've been very diligent with them. I do them twice a day, usually morning and evening.
So even before we started this listening, I told you twice, thrice, something like this will come. So there are some answers which we can do even beforehand because we have an idea of it. Twice a day, thrice a day, that is happens. Okay. And now the next.
For about 20-25 minutes each session. The quad sets, knee bends, heel slides, leg raises. I try to do them exactly as you demonstrated. I've even added a couple of more repetitions to some of them, as you suggested I could, if they felt easy.
That's exactly what we want to hear. Your dedication to your exercises is really paying off. The more consistent you are, the better and faster your recovery will be. Now let's talk about those concerns you raised earlier and how we can address them.
Okay.
Regarding the morning stiffness and the mild swelling after walking, as I mentioned, these are very common. The stiffness will gradually reduce as your knee continues to heal and your muscles get stronger and more flexible. For the swelling, it's a sign that you're pushing your activity just a little bit, which is actually good as long as it's not accompanied by an increase in pain. It means your body is responding to the demands you're placing on it.
So it's not a bad sign then? I was a bit worried I was overdoing it.
Not necessarily a bad sign at all, as long as it's mild and resolves with rest and elevation. It means you're finding your limits, which is part of the process. We want to gradually increase your activity, but smartly. Let's talk about increasing your walking time. You mentioned you walked for 20.
Now, until now, everything was unimportant, but I listened to it carefully. And the stronger, the faster, the better. Understand till the time it is mild. So keep on listening to this conversation so that your ears can adapt. And then now the total walking time she is talking about, it should not be more than dash each week.
Minutes yesterday. How did that feel during the walk itself?
It felt good, actually. I was enjoying the fresh air. It was only afterwards that the swelling came on.
Perfect. So here's how we can safely increase your walking time. Instead of thinking about one long walk, try to break it up. For example, if you want to aim for 30 minutes of walking in a day, you could do two 15-minute walks or even three 10-minute walks spread out throughout the day. This allows your knee to rest and recover in between, reducing the chance of excessive swelling.
Oh, that's a good idea. I hadn't thought of it splitting it up.
Exactly. Listen to your body. If you feel a mild ache starting, that's your cue to slow down or take a short rest. The goal is to gradually increase the total duration and frequency, not necessarily the intensity or speed right now. Aim to increase your walking duration by no more than 10 to 15% each week. So if 20 minutes
So this was easy, 10 to 15%. And in the final exam, how do you write it? You can simply write 10 to 15%. That's it. 10% to 15%. Okay, done. And the last, then we will do part B and C.
Manageable, maybe next week you aim for 22 to 23 minutes as your longest single walk, or increase your total daily walking time to 40 to 45 minutes spread out.
That makes sense. I'm more gradual.
Because we have done this question, so we are not realizing it. But some people also feel challenging that now she's saying 40 to 45 minutes. Earlier she was saying 5, 10 minutes, 15 minutes. That is what sometimes people in the exam, they panic. Now we have realized obviously that it is each week. But sometimes you don't realize whether he is talking about week, hourly, and that is also sometimes we can do wrong. So again, focus is the only thing. Listening is all about focus. We cannot fail in listening if we are in the present moment. So each week was an important word over here. Otherwise, it was easy. Otherwise, it was confusing if you don't read each week. Then he was talking about 15 minutes, splitting the walk, then 45 minutes, 40 to 45. But the overall, the weekly time was the major thing that we had to notice.
Exactly. Now about the stiffness, especially in the mornings. Regular stretching is going to be key. Are you doing any specific stretches for your knee and the surrounding muscles?
I do the heel slides, which
Again, now she talked knee, but the answer should be in the heel slides. By chance, he has spoken. Suppose sometimes he will talk about knee slides as well as heel slides. But my question is again about heel slides. That is where my focus should be. So by chance, he's talking about only heel slides.
Stretch the back of the knee and the quad sets. I try to do some gentle bending and straightening of my knee before I even get out of bed.
That's a great start with the gentle movements in bed. To specifically target stiffness, I want to emphasize holding your stretches for a bit longer. When you do your heel slides, try to hold that bent position for 20 to 30 seconds.
Okay,
And
this was also easy. But now the major thing what we have learned, if you would have noticed that peculiar things about this listening, the main thing that also I would like to discuss, the major answers were given by a male voice until clinical assessment, and majorly the management plan was talked by the lady because she is the expert. So that is where you understand the difference of the voices as well, that which voice is important at which point. So part A sometimes are challenging, but if by chance, now I will tell you how to improve. So this was an easy, I agree. Sometimes it is very difficult, sir. I totally agree. I understand that part too, but I chose it randomly. We can't do all the listenings. Next time you tell me which listening I should do, then I will do in front of you. But yeah, in this, whatever I could tell you, spelling mistakes, we have talked about that medication spelling mistakes can be wrong. But again, salt name cannot be wrong. Salt name is important to be right, like paracetamol, ibuprofen, amoxicillin, clavulanic acid, you can't do them wrong. You have to be right and spot on. So practice them, lot of spellings. Write neatly. Even writing can be problem for some. So please write neatly. Sometimes we take it very lightly. One of the examples we did was stiff word is not correct here, because if I read this sentence with the stiff word, primary issue on the walking is stiff in the knees, stiffness in the knees. So you have to understand which word is fitting in. This is also your responsibility in the final exam. So don't say, sir, I understood it's one and the same thing. No, it's not one and the same thing. Then notice the prepositions. Again, articles are very important, and these words are important. That is what I wanted to discuss until now. So, and in the final exam, that is the best part, that if you have done the warm up, the first part is listening part A. And do you know, feelings are very important, and you can well understand OET's pattern. What they want you is to pass. How do I know that? Because they did not give you multiple choice first, because they also know that a candidate, before he does multiple choice questions, he or she needs to fill in the blanks to make it easy for them. So they want to make your job easy ultimately. When you will think like this, mindset will become better. So now we will jump on to the part B and we'll do two questions. I will directly take you to the part B without any delay, because we don't want to waste much time. So let's see this part B question. I'm just going to put this box. So obviously in the part B, you always get a kind of a background check like this. You hear a nurse giving a patient discharge instructions, focusing on wound management at home. So at home, wound management, what is the most? Again, see, even before I started teaching you this listening session, I told you degrees. See guys, that is what I want to tell you. It's not only OET, any exam you will take in this life. It's not only OET, again, I'm telling you. Any exam you will take, this becomes very important to read the question carefully. What is the most critical instruction the nurse gives Mr. Johnson regarding her discharge? So that means the nurse will give multiple instructions, but you have to find the most. So that means when they will be speaking, the greatest, the most important, the something would come, and that would be our answer. So let's see and let's try and execute this question. Okay, I'm just going to do that, and I'm
That
gonna play
you'll
that.
continue make your medication and have my assistant call you with the appointment details. Please don't hesitate to contact us if your pain worsens or if you have any other concerns before your next appointment.
I will.
Generally, by chance I'm listening, by chance I was going to part B, but generally saying a, for, an, a, his. This is also I have told you. These are the small things. His. Again, it's very important. So when the patient will say my, he will speak my, and my will become his. So these are the small things that create difference. After, over. So notice these words, at a time. So these are the words when you will start noticing, your life will become easy. Okay, now we're going to part B, of course.
Thank you.
What is the most critical? She must, okay, now I'm reading it. She must contact the clinic immediately.
All right, Mrs. Johnson. Before you head home, let's go through your discharge plan together. Continue your low salt diet and take your medications as prescribed. Now, about the wound, it's showing good signs of healing, but it still needs regular care. Try to keep the area clean, dry, and covered, and remember that the dressing should be replaced once every day. Doing it daily helps keep the wound free from moisture and reduces the risk of infection. When you change,
So generally saying, till now she has spoken the word should. Again, please just notice should means chahiye. It is not must. So must means 100% and 100% means the most critical. Must, the most word can also be replaced by must. Must means that you have to do it, and you have to do it means most critical. So I also have to focus on the word must and should. Okay, let's do it again.
together. Continue your low salt diet and take your medications as prescribed.
Sorry.
I'll send through your discharge plan together. Continue your low salt diet and take your medications as prescribed. Now, about the wound, it's showing good signs of healing, but it still needs regular care. Try to keep the area clean, dry, and covered, and remember that the dressing should be replaced once every day. Doing it daily helps keep the wound free from moisture and reduces the risk of infection. When you change it, take a brief look to make sure everything appears normal. If you happen to notice any unusual discharge, particularly if it's yellowish or has an unpleasant smell, that could suggest infection, and you should let us know. The district nurse will assist with the changes for the first few days so you can see the correct technique, but after that, you'll continue managing it on your own. If the area becomes warmer than usual, turns red, or the pain suddenly gets worse, contact the clinic straight away. Staying consistent with daily care is the best way to make sure your recovery continues smoothly.
Now see, this simple question has become tough for me, to be very honest, because she has spoken all the things. She has spoken about low sodium diet. Continue word has also been used. The dressing must be changed every day to prevent complications. This also she has spoken. And third, she has also spoken that if the wound becomes warm, then contact the clinic immediately. But I could not find the word most, and that is where I lost this question. I lost it. But if I have to put a tukka, if I have to make a fluke, tukka is fluke in English. If I have to put a fluke on it, then I would say maybe C instruction is something that she has told. She has spoken the word immediately, she has spoken the word contact, but I could not hear the word must. But if it is not my final exam, that is what I want to learn, and that is where I need to repeat. So let's repeat again.
Really helps keep the wound free from moisture and
Okay. Let's see where the mistake was
Mrs.
done.
Johnson, before you head home, let's go through your discharge plan together. Continue your low salt diet and take your medications as prescribed. Now, about the wound, it's showing good signs of healing, but it still needs regular care. Try to keep the area clean, dry, and covered, and remember that the dressing should be replaced once every day. Doing it daily helps keep the wound free from moisture and reduces the risk of infection. When you change it, take a brief look to make sure everything appears normal. If you happen to notice any unusual discharge, particularly if it's yellowish or has an unpleasant smell, that could suggest infection, and you should let us know. The district nurse will assist with the changes for the first few days so you can see the correct technique,
But after that, you'll continue managing it on your own. If the area becomes warmer than usual, turns red, or the pain suddenly gets worse, contact the clinic straight away. Staying consistent with daily care is the best way to make sure your recovery continues smoothly.
So, guys, in this, even now, I could not find it. So, I need your help. Please participate and let me know if anybody has any suggestion. B is not the answer as far as I think. What do you say? A or C?
मेरे को
Sir,
A
C.
लगता है.
Hmm?
C, sir.
Why C? Why
Yes,
A?
sir.
A.
सर C
A
ये
है
वो
सर.
बोल रही थी, पहले ड्रेसिंग खुद ही चेंज करना, उसके बाद पर डे चेंज करनी है.
Hmm.
सी में ये बोल रहा है वो.
C means
ए में
she's
वो कह.
C means she said na, that you have to change it every day. So that means
Yes.
C is our priority as per me because dressing has to be changed.
Should
I
be
think
Yes.
changed. Yes, sir.
she said should be, but I believe that if she will not change the dressing, then it would be a problem. Because the third instruction is she must contact the clinic immediately. Even that was very important if she observed the wound becoming warm to touch. But there was a word, if you remember, she used the word particularly. Actually, the answer should have been that. Did you notice this word particularly, guys? Particularly was the main word, but she said at that time when she said it, if it become yellowish or wet. So if there would have been any option like yellowish or wet, then though I would have done this 100%. Particularly word was there, but somehow the clinical person has not created a very good question. In a way, obviously it must be good, but I am unable to trace it, to be very honest, sitting along with you. So she should contact the clinic immediately, she has said, if she observes becoming warmer. But warm ki jagah she also said the word warmer. So that is why one thing I'm thinking these both things are not matching. One thing. Second, what I feel is that changing dressing is the first important instruction. That is what I feel. But let's listen to the last time and particularly word also. Please pay attention to this word particular as well this time. Let's see how it goes. Let's do it last time because it's an easy question otherwise, but the options are very confusing. So sometimes the questions are easy, but the options are confusing. And just one time I want to hear if you would allow me. I'm really sorry.
It's showing good signs of healing, but it still needs regular care. Try to keep the area clean, dry, and covered, and remember that the dressing should be replaced once every day. Doing it daily helps keep the wound free from moisture and reduces the risk of infection.
See, she is saying it is important to change the dressing. See, again, now coming to the basics. It's important to change the dressing, otherwise there can be risk of infection. So I think important instruction is this, that follow this instruction. If you don't follow this instruction, then infection will happen and then these things will happen. So the primary instruction I think is to change the dressing daily. That's what I feel. Let's listen further. If she has spoken anything else.
When you change it, take a brief look to make sure everything appears normal. If you happen to notice any unusual discharge,
Unusual
particularly if
discharge,
it's yellowish or has
particularly
a
yellowish.
smell, that could suggest infection, and you should let us know. The district nurse will assist with the changes for the first few days so you can see the correct technique, but after that, you'll continue managing it on your own. If the area becomes
Now, in the final exam, what I will do, according to what my knowledge is, I will do C. I don't know whether if they would have given answer A as well. I don't know. Trust me. But in this case, what I want to teach you guys is that I would have surely done C because first, that dressing has to be changed every day. Otherwise, there would be an infection. But there is one more problem if you notice. Infection word has been named as complications. But infection and complication is the same thing when it comes to dressing. So that's why I'm taking this option. But if they would have given answer as an A, then obviously he would say infection is not equal to complication. But according to us, we all know infection is complication only. Second thing, the priority point is that changing the dressing is important. If we will not change the dressing, then infection can happen and then these signs can come. But if there would have been said particularly wala word, yellowish word would have been given or discharge word would have been given, then I would have surely done A. But again, in the scarcity of above things, I feel C should be the answer. So I don't want to check the answers, to be honest,
Than usual.
because it will make us go vulnerable. So I will check this answer later on, or you can also check it. But what I want to teach you is this. I would like to do C because this is the first instruction that you have to change the dressing every day, very particularly has said. And complications means infection. And if he will not do so, then these things will happen. And if these things will happen, then you need to contact the clinic. So it is the second step. So if I talk about my priority is to change the dressing every day. So this is the most critical instruction that I would like to connect with. Any doubt, guys? आप कुछ भी participate कर सकते हो. You can participate in anything. You can give me your suggestions because you all are nurses. But and don't ever say, sir, according to knowledge, obviously C is correct. I'm not saying according to knowledge. According to knowledge, it is correct, obviously. But also otherwise, according to what she is saying, because she is saying unusual yellow discharge that has not been given over here, and she just said that you need to contact the clinic if it is immediately word has been mentioned. Immediately means obviously urgency is there. But again, the major instruction I feel is that dressing has to be changed every day. Otherwise, it can lead to complications. So I will take it as C if I am alone, and if the answer is not given. Even if it's given A, then I'm happy to do it wrong. But according to me, answer should be C because this is the most critical instruction that patient has to follow, that he has to change his dressing every day. And also there is one more thing somebody was saying that I did not notice, but that also that patient has to do the dressing. Patient has to do change the dressing himself as well. So obviously this is the instruction from me to the patient that you have to also change the dressing. Just
Remember that
let's listen to one more time because there is one more point that's coming to me.
A lot of sense.
Sorry, one more point is there which we can discuss, that who will change the dressing.
regular care. Try to keep the area clean. Any unusual discharge, particularly if it's yellow grived. Now, about the wound, it's showing good signs of healing, but it still needs regular care. Try to keep the area clean, dry, and covered, and remember that the dressing should be replaced once every day. Doing it daily helps keep the wound free from moisture and reduces the.
And also she used the word remember. So remember word is also going in. See, that is what I am teaching you. That is what I am telling you. Do your listening 3 times. Even if your answer is right, you will still learn. Now there is one more word that is supporting part C is remember. Agree, guys? Do you all agree?
Yes, sir.
These are the and we will
Yes, sir.
and in exam you will get only one chance and it goes like this. So obviously we have to practice the same listening again. That is what my way of teaching is, and it is actually the best way that you have to listen to it again. Now I can listen to the word remember. Remember is a very strong word. Everybody will agree. Remember.
Yes.
Huh? So
Yes, sir.
I will stick to C as my answer. Okay. Let's do a little further. Let's go a little further and do one more question of part B. Then we will do part C. Just will take a little bit of time.
The risk of infection. When you change it, take a brief look to make sure everything appears normal. If you happen to notice any unusual discharge, particularly if it's yellowish or has an unpleasant smell.
And again, as I always say, don't do 20 questions in a day or do maximum one listening in a day. But whatever you do it 2-3 times because you will learn. Remember, then change the dressing, particularly. So I can listen to all the words when I'm listening to it first time because my ears have started noticing, my mind notices these words. So your mind should also be able to grab particularly. Remember, small things make big difference, right? Now, next question.
That could suggest infection, and you should let us know. The district nurse will assist with the changes for the first few days so you can see the correct technique, but after that, you'll continue managing it on your own. If the area becomes warmer than usual, Consistent with daily care is the best way to make sure your recovery continues smoothly.
Okay, guys. Just 1 second, guys.
Lisinopril.
Okay.
There are a few side effects you should be aware of. The most frequently reported.
Guys, is it audible to everyone? And am I audible to everyone as well? Where is it?
Yes, sir.
Okay, thankfully. I lost myself somewhere. Just a second. Where is my Zoom? Okay, yeah.
Is a dry, lingering cough. It's generally mild and doesn't require treatment. But if it becomes troublesome or interferes with your daily activities,
Sorry, I've lost the thread of the conversation. Just give me 1 second.
Your own. If the area to make sure your recovery.
Okay. A pharmacist is advising a patient about the common and serious side effects of a new blood pressure medication.
Mr. Davy,
So basically, a pharmacist is advising a patient about the common and serious side effect of a new blood pressure medication. So according to pharmacist, what specific? Again, what I told you is that these are the words which are very, very important, guys. These are the words to be noticed again. Pharmacist, specific symptom requires the patient to seek immediate emergency. So one is, this word is very important, and specific symptom. Let's go for it. Okay.
I'd like to take a moment to discuss your new blood pressure medication, Lisinopril. There are a few side effects you should be aware of. The most frequently reported is a dry, lingering cough. It's generally mild and doesn't require treatment. But if it becomes troublesome or interferes with your daily activities, please contact your GP for advice. Occasionally, some patients experience facial or lip swelling, which is a rare but serious reaction. Should you notice any swelling of...
Sorry, guys, my attention has been taken somewhere. Sorry.
Take a moment to discuss your new blood pressure medication, Lisinopril. There are a few side effects you should be aware of.
Now, when I'm doing
The most
this,
frequently reported is a dry lip.
by the time she's speaking, my attention would be on options because I have already read what specific symptom. Experiencing dry persistent would be my word. Disruptive. Feeling dizzy during the first week. This is my main word. And noticing swelling in the face. Face, first week, and dry, persistent, and disruptive. These are my keywords. Let's see which words she will speak.
Cough. It's generally mild and doesn't require treatment. But if it becomes troublesome or interferes with your daily activities, please contact your GP for advice. Occasionally, some patients experience facial or lip swelling, which is a rare but serious reaction. Should you notice any swelling of the face, tongue, or throat, stop taking the medication immediately and seek urgent medical attention.
Okay. So this seems easy. Guys, this seems easy.
Yes, sir.
I know this
Yes,
is
sir.
easy C. This is a direct answer. So I hope this would be correct. So these are some questions. These are kind of questions which also come in the exam. That's where I told you at least 4 out of 6 would be easy. Trust me, this would always be there. At least 3 questions would be damn easy. And out of the next 3, you just have to do 1 right to make it 4 out of 6. So if we make 4 in the part B, 4 in the part C first, plus 4 in the part C second, we make 12 marks. So that is where I said 20 in the part A and 12 in the part B. Do you understand the calculation again, guys?
Yes, sir.
Please
Yes,
understand,
sir.
don't panic in listening. I promise you at least 3 questions would be easy, 3 plus 3 plus 3. Now you have to just add 1 to each, that out of the rest 3 in all, you have to do like the first question. If we do it right, suppose if the first question, let's check the answer if it is right or wrong. Generally, Let me check it if the answer is given. So, what was the question number that we did?
25, sir.
25.
25 and 26.
25th is C, 26th is C. So we get 4 out of 4. And this is how I even do my calculation. Then we do 5 out of 6 is if I improve my listening. So that is how my marks start getting better. So I swear on anything, I was not sure about this. But it is the improvement because I understand, remember. Now this is learning for me. But if I check my answer and I say, oh, I don't know, my listening is not good, obviously it's never gonna improve, guys. Please try and understand. Everything will happen according to our practice, our mindset. When I listened to it for the third time, then I heard the word remember. And then now I will remember forever, both in reading and listening. So this is what we need to do. For now, I think this is a class of enough. We will do the part C in the next class if you would allow. And please practice because I have told you multiple choice. Even in the C part, again, it would be little faster. That is the thing. But again, don't forget the calculation. Don't forget the calculation, which I am mentioning again. Please, each and every word I have spoken in this video, speaking videos are not easy to make. Like they say, na, laughter, comedy is not easy. In the same way, teaching listening is not easy. And learning listening is also not easy. But yes, we all have tried our best. I have tried my best to have the patience. And I hope you also had the patience to learn. So now considering both the things, really good that we both have given our 100%. Try to do these 4 questions and try to get 3 correct yourself from this listening by typing in the. So if you get 3 correct, 2 I have done for you, 5 out of 6, 5 out of 6, 5 out of 6 will make 15. In the part A, 20 plus 15 will make it 35. We normally need 30 to pass. If we score 32, it's a short pass. If we score 35, it is 400. So again, please be very, very strong with your calculations. Part A, we are targeting 20 minimum. And 20 also drained, stiffness, 15, 20 evenings. One question I was not able to do, I don't know, was 20 minutes evening walks or something like that. 20 minutes morning walk, okay. Overnight, 2 or 3, paracetamol, crutch, twice, 10, 15%, 30. All questions are correct except one. So I told you one question I will take. So 11 out of 12. So 11 plus 5 will make plus 5 plus 5 will make my calculation plus 11. Sorry, I should also take that or 10. So 21 is good marks in the party. So that is what your target is when you are planning that way. Okay, guys. Now we will meet each other in this week only for part C of the listening. Is it all good? And I will share this recording on YouTube. Please share it with your friends and with yourself. Again, it requires patience. But again, if you will do this one listening again, means अब मैंने आपको करवा दी. If you don't revise it over the YouTube, then it's not a good idea because you will not remember, particularly remember to, a, and, the, for, overnight, after, before. LY words are very, very important, both in reading and both in listening. Once you start noticing words, both things become cherry cake walk. Okay, guys, see you. We'll catch you the next time, maybe in 1 or 2 days for the listening part C session. And also revise that reading video so that part C listening goes very well. Okay, guys, take care. Thank you.
Thank you,
so
sir.
much, sir.
Thank you so much, guys.
Thank you so much, sir.
Thank you so much, guys. Thank you.